HIV. It's a term that carries weight, evokes fear, and often silence. For decades, this virus has cast a shadow across the globe, impacting millions of lives. But HIV doesn't discriminate. It doesn't care about your age, gender, background, or lifestyle. Anyone can contract HIV, and the first step in protecting ourselves is breaking the stigma surrounding it. We need to talk about HIV openly and honestly. So, let's shed light on HIV, dispel the myths, and face this global challenge together. What exactly is HIV? HIV stands for Human Immunodeficiency Virus. It's a complex virus that directly attacks the body's immune system, specifically the CD4 cells, also known as T cells. These cells are crucial in helping our bodies fight off infections and diseases. Without treatment, HIV can progress to AIDS, acquired immunodeficiency syndrome. AIDS is the most advanced stage of HIV infection, where the immune system is severely damaged, leaving the body susceptible to a range of serious illnesses. The good news is that HIV is no longer the death sentence it once was. With early detection and proper medical care, people living with HIV can now live long, healthy, and fulfilling lives. Advancements in treatment have made it possible to manage HIV effectively, suppressing the virus and allowing the immune system to recover. Recognizing the early warning signs of HIV is crucial in seeking timely medical attention and accessing life-saving treatment. By understanding the potential symptoms of HIV, we empower ourselves to take charge of our health. Early detection is not only about protecting your own health, but also about preventing the further spread of HIV. Remember, knowledge is key. Our bodies have a remarkable way of communicating distress. HIV, especially in its early stages, can trigger a range of seemingly common symptoms that often mimic those of other viral infections. These early warning signs are not meant to cause panic, but rather to encourage proactive health-seeking behavior. If you notice these symptoms persisting or worsening, it's essential to consult a healthcare professional for proper evaluation and testing. Early detection is paramount in managing HIV effectively. One of the most common early signs of HIV is fever. This fever, often accompanied by chills and night sweats, can be mistaken for a common cold or flu. However, unlike a typical cold that resolves within a week or two, fever associated with acute HIV infection can linger, often accompanied by persistent fatigue that doesn't improve with rest. If you experience a fever that lasts longer than usual, or if you're feeling unusually fatigued for an extended period, it's essential to consult a healthcare professional. They can assess your symptoms and determine if further investigation, including an HIV test, is necessary. Another common early sign of HIV is skin changes. These changes can manifest as a rash, often appearing on the torso, chest, or back. Swollen lymph nodes are another telltale sign that your immune system is fighting something. When your immune system is activated, these lymph nodes can become enlarged and tender to the touch. If the swelling persists for several weeks, particularly if accompanied by other symptoms like fever, fatigue, or skin rashes, it's crucial to seek medical attention. Remember, early detection is crucial in managing HIV effectively. While both men and women can experience common HIV symptoms, certain signs are more pronounced in men. One noticeable sign is the appearance of genital ulcers or sores. These sores can be painful, itchy, or bleed easily. Any unusual sores in the genital region warrant immediate medical attention. Erectile dysfunction, or ED, can be a potential warning sign of underlying health conditions, including HIV. While ED can stem from various factors like stress, anxiety, or other medical conditions, its persistent presence, especially in conjunction with other HIV symptoms, should raise concern. HIV can directly and indirectly contribute to ED. The virus can damage nerves and blood vessels, impacting blood flow to the penis, which is essential for achieving and maintaining an erection. If you're experiencing ED while on HIV treatment, it's crucial to discuss this with your healthcare provider. They can help determine the underlying cause and explore potential adjustments to your treatment regimen or recommend alternative therapies. While HIV primarily attacks the immune system, it can also disrupt the delicate balance of hormones in the body. In men, this hormonal disruption can manifest in a range of symptoms that extend beyond the typical signs of infection. One of the key hormonal changes associated with HIV is a decrease in testosterone production. Low testosterone levels can manifest in various ways, including fatigue, decreased muscle mass, weight gain, depression, difficulty concentrating, and loss of libido. If you're experiencing any of these symptoms, especially in conjunction with other potential signs of HIV, it's crucial to consult a healthcare professional. They can order blood tests to assess your hormone levels and determine if HIV is a contributing factor. HIV doesn't discriminate, and its symptoms can manifest differently in women compared to men. Often, these symptoms mimic common health concerns that women experience regularly, making them easy to overlook or dismiss as unrelated to HIV. One of the most frequent signs of HIV in women is the increased occurrence of yeast infections. Yeast infections can cause itching, burning, pain during intercourse, and a thick white discharge. While many women experience occasional yeast infections, frequent recurrences, especially if accompanied by other symptoms like fatigue or swollen lymph nodes, warrant HIV testing. Another common sign is pelvic inflammatory disease, or PID, an infection of the reproductive organs that can cause pelvic pain, fever, irregular bleeding, and painful intercourse. For women, the menstrual cycle serves as a vital sign of overall health and hormonal balance. Any significant changes in this cycle can signal underlying health concerns, including HIV infection. One of the most common menstrual changes associated with HIV is a shift in the regularity of periods. Women may experience shorter or longer cycles, unpredictable bleeding patterns, or even miss periods altogether. Persistent or significant changes in your menstrual cycle, especially if accompanied by other HIV symptoms, warrant prompt medical attention and testing. It's essential to remember that menstrual irregularities can stem from various factors, including stress, diet, exercise, and other medical conditions. Women living with HIV face an increased risk of cervical cancer. This is due to the virus's impact on the immune system, making it less effective at fighting off HPV. Regular cervical cancer screenings, including Pap smears and HPV testing, are crucial. Early detection is vital for successful treatment and improved outcomes. In the realm of health, knowledge is indeed power. For too long, fear, stigma, and misinformation have shrouded this virus in a veil of secrecy and shame. But knowledge dispels fear, breaks down stigma, and empowers us to take control of our health. Knowing your HIV status is not just about you, it's about protecting yourself and your partners. Early detection is crucial in managing HIV effectively. Living with HIV is no longer the death sentence it once was. Advancements in treatment have made it possible to manage the virus effectively, allowing individuals to live long, healthy, and fulfilling lives. Take the courageous step to get tested. HIV testing is now more accessible, confidential, and less invasive. Modern methods are quick, discreet, and user-friendly. Rapid tests detect HIV antibodies in 20 minutes. Available at health centers, clinics, and pharmacies. Methods involve a simple finger prick or oral swab. Confidentiality ensures your results remain private. Getting tested for HIV is about prioritizing your health and well-being. It's about making informed choices to safeguard your future. Knowing your status empowers you to navigate relationships and access care. If you test positive, remember you're not alone. HIV is not a death sentence. With early detection and care, you can live a fulfilling life. Your healthcare provider will connect you with resources and support. If you test negative, continue practicing safe behaviors and get tested regularly. Getting tested is a sign of strength and commitment to health. In an ideal world, HIV testing would be readily available, affordable, and accessible to all. Barriers still exist that can prevent individuals from getting tested. However, resources and support are available to overcome these obstacles. Many communities offer free or low-cost HIV testing services, often through public health clinics, community organizations, and mobile testing units. Stigma and fear of judgment can deter individuals from seeking testing. Healthcare providers are bound by confidentiality agreements and are trained to provide non-judgmental care and support. Numerous organizations and support groups provide education, advocacy, and a sense of community for people living with or affected by HIV. Reach out to your healthcare provider, local community organizations, or national HIV hotlines to access testing, care, and support. We've covered a lot of ground today, exploring the signs and symptoms of HIV. These signs are not meant to instill fear, but to empower you with knowledge. Knowledge is the first line of defense for a healthier future. HIV doesn't discriminate, but our awareness can make all the difference. Early detection is paramount. Get tested regularly and practice safe behaviors. This journey is about compassion, understanding, and support. If you're concerned, reach out to your healthcare provider. You're not alone. Let's break the silence, replace fear with knowledge, and prioritize